Why is regular screening critical for HPV and cervical cancer? Imagine catching a problem early before it becomes serious. That's exactly what regular screening can do for HPV and cervical cancer. Human papillomavirus is a common virus, and most sexually active people will get it at some point. While many infections clear up on their own, some high-risk types can cause changes in cervical cells that may develop into cancer over time. Screening helps identify these high-risk HPV infections and any abnormal cell changes early, giving healthcare providers a chance to intervene before cancer develops. The main screening tools for cervical health are the Pap test and HPV DNA testing. The Pap test looks for abnormal cells on the cervix, while HPV testing checks for the presence of high-risk HPV types. Combining these methods increases the chances of catching issues early. Studies show that HPV testing is more sensitive than Pap tests alone in detecting precancerous changes, which means it can identify problems sooner and more accurately. Early detection allows for less invasive treatments and better outcomes. Regular screening has a proven track record of reducing deaths from cervical cancer. When women participate in routine screening programs, the number of advanced cervical cancer cases drops significantly. This is because abnormal cells can be treated before they turn into cancer, saving lives. Screening also helps identify women who may need more frequent checkups, especially if they test positive for high-risk HPV. Tailoring screening schedules based on individual risk ensures resources are used wisely and unnecessary procedures are avoided. Even with the availability of HPV vaccines that protect against the most common cancer-causing types, screening remains essential. Vaccination reduces the risk but does not eliminate it entirely, especially for women who were exposed to HPV before vaccination or who are not vaccinated. Combining vaccination with regular screening provides the most comprehensive protection against cervical cancer. Transitioning to HPV-based screening methods involves some challenges, like costs and access, but the benefits are clear. More effective screening strategies can lead to fewer cases of cervical cancer and save lives. Public health efforts continue to focus on increasing screening participation, especially in underserved communities. Remember, individual risk varies, so it's always best to consult your healthcare provider to determine the most appropriate screening schedule for you. In summary, regular screening for HPV and cervical cancer is a vital part of early detection and prevention. It helps catch problems early, reduces the chance of developing cancer, and saves lives. Screening works best when combined with vaccination and personalized healthcare advice. Always talk to your doctor about when and how often you should be screened to stay ahead of potential health issues.